Hi, I'm Dr. Nihar Parekh, and with me is Dr. Vyas,
Hi.
an eminent pediatric dentist. And today we're going to embark on a journey to help you give your children the best healthy teeth. A lot of mothers want to schedule their child's daily activities. They want to make sure the baby sleeps on time, eats on time, and brushes on time. They are very particular about doing this. What regime would you recommend? Morning brushing, night brushing, once a day, twice a day, age-appropriate brushing techniques and programs would you recommend the children at different ages?
Oral hygiene measures at whatever age you start, we said 8 to 10 months, should be done twice daily. The important thing is to set the routine. So brushing should be done both morning as well as at night. And it's very important to brush at night. I say that night brushing is more important than brushing in the morning, because when a child falls asleep, if there's any food stuck on his or her teeth, that is what actually contributes to the early childhood decay. So night brushing is a must, and make sure that it becomes part of the child's routine. At this point, I also want to add that the use of a soft brush or a brush with soft bristles is always recommended. Never a medium, never a hard. So even if you find that the child has some kind of residue on the teeth, please stick to only a soft brush. There are numerous brushes which are available, locally, some which are imported, and you could use that. As far as toothpaste goes and the low fluoride toothpaste goes, the ones that are available in the chemist, the locally available toothpaste, are as good as the international toothpaste because they use the same formulation. So please don't rush and buy the imported fancy toothpaste. You could use the standard local toothpaste and they are equally good.
For any queries, you can write into us on or WhatsApp us on